Blog Talk Radio. Welcome to Women Who Rock Investigate, an affiliate of Women Who Rock with Success. We report case studies in the areas of policy and government, medical malpractices, health pandemics, biotech and fracking, global climate change, prison, and police reform, and more. Our topics are covered around the latest breaking news reports in the U.S. and around the globe. We can be heard on Spotify, Google Play, Google Podcasts, TuneIn, iTunes, Podbean, Airtime Pro, and SAM Broadcasting radio stations, and more. Our hand-picked experts on the show provide credible information from their field.
Hey, this is Dr. Colbert. Hello.
Join us on Thursdays at 10 a.m. Central Standard Time as we discover the latest in news reports. Now, join us live in the studio with our show host, Mrs. Diane Winbush.
And good morning, and welcome to Women Who Rock Investigates. This is your show host, Ms. Diane Winbush. And so today on the show, we will be doing a more deeper study into COVID-19. And so the purpose of this, I know everybody is tired and sick and tired of hearing about COVID-19. It's become an aggressive topic. And so the purpose of we doing the show continually is to provide resources, facts, and information to the audience and to the public as to the latest breaking news and information. And so with that being said, we're going to go ahead and introduce our panel. The first guest that we have on the show today is Dr. Nana Afua Marin, and so she will be with us today, as well as Dr. Chris Colbert, and as well as Dr. Jita Nair. And so welcome to Women Who Rock Investigates, everyone, and good morning.
Hey, good morning.
Good morning.
Okay, so first we're going to start with Dr. Nana, and she's going to let us know a little bit about her and about her practice and why she got started in the field that she now occupies now, and to be able to share a little bit with the audience about her.
Yes, good morning. Thank you so much for inviting me to be a part of this morning. My name is Dr. Nana Fomen. I am an emergency physician in the LA area and public health practitioner and educator. I have done a lot of work in disaster and emergency response internationally in the U.S., practicing for over 15 years. And during the pandemic, I was on the front line ER and dealing with communities that just were completely disenfranchised from the lack of access to emergency services during the pandemic itself. And what struck me the most was that we were quickly able to pivot to telehealth services for people who were connected, but the safety net was breaking really fast. And the devastation among African American and Latino communities were most deeply impacting for me as an African American physician. And so myself and other physicians started the Shared Harvest My COVID-19 initiative, which was a health equity initiative. We got out to communities that didn't have health resources and created a public telehealth platform, in addition to getting free vaccines now to over 13,000 individuals in the Southern California area that were in health deserts. And so the work that we've been doing for the past 18 months is to debunk myths, get on platforms such as this to tell the real story about what's happening on the ground and help people filter through some of the medical jargon so that we can make sure people keep their families and their ecosystems safe. And I'm so glad to be on this today.
Okay, great. And thank you so much for being with us as our guest. Dr. Colbert?
Hello, everyone. My name is Christopher Colbert. I'm an ER physician here in Chicago. I'm the assistant program director at University of Illinois, very passionately involved with not only education, but also within the social disparities of health. I'm also a lieutenant colonel in the United States Army, recently returned from deployment And our deployment focus was addressing and assisting in addressing other countries navigate through a pandemic as well. Diane has always been a gracious host and inviting me, and I always return. I'm looking forward to engaging in a really great conversation, expanding the dialogue on this topic, and look forward to having this great panel with really great providers so we can push forward and move forward collectively in educating and practicing better health practices.
Okay, great. Thank you. Okay, Dr. Jeter. Dr. Jeter, are you on? Okay, so I thought I heard her in the beginning, but okay. So we're going to start with Dr. Nana. So Dr. Nana, okay, so some of the questions that we're going to address today. So share with the listeners a little bit about the meaning of boosters. What are boosters for is the COVID-19 vaccinations?
Yeah, so one of the biggest misconceptions about boosters is that it is always the case that everyone responds to the vaccine the same. And so a booster gets you back to track on being able to respond to the pandemic. And I would like to start by making a quick distinction between the booster and the third dose. So like all vaccines that we have, the goal is to build immune response in your body. And it's not an all or none sum game. Sometimes individuals, depending on where their immune response is before they get the vaccine, will mount up a very strong response. And for those who have the Pfizer or Moderna vaccine, those who we saw the response rate was high up in the 80s and 90s, which was really, really great. And with J&J, the response rates were about 70% and higher, at the high 70s. And so there was the first cocktail was 2 doses for the Pfizer, 2 doses for Moderna, 1 dose for J&J. But over time, just like anything else, our immune response dwindles a bit. And if you are immune compromised when you first get it, you may not get into that threshold that we thought was ideal. And so those individuals, those over 65, those with immune compromising conditions, those who are seeking other medical or care like cancer or rheumatological diseases, have been selected to increase their dose response by getting a third dose, and that's to get them to that threshold. The conversation we're having now is beyond that group. We're seeing that the rate of response may be affected, and so a booster from a larger population may be even better. And that's what we're seeing. The latest information just came out with Moderna being a half dose, not the full dose, but a half dose of the initial subscribed vaccination dose as a booster. Pfizer is the full dose. And then J&J surprisingly came out with the addition of a booster after 2 months, which is literally anybody who's ever got J&J is being recommended to do the second dose. And I think that's where we as a health community have to be careful, because we don't want to feel like we're marketing something and in one way and then saying something 6 months later the other way. We said J&J was one and done, and now we're talking about a booster for basically everybody. And so I know my colleague on the line right now would probably say the same. You know, it puts us in a hot mess situation as health providers to try to explain why the change and at this point.
Absolutely. Because with the boosters, a lot of individuals are misinterpreting the booster as what you stated with the third vaccination, because it has been a lot of misconception as to who is qualified or recommended to be able to take the booster versus those that were, when it first came out, it was a lot of people that was able to get it versus, you know, in regards to now they're putting certain restrictions as to who can be able to get the booster, because I know a lot of people here in our area was able to get it from the beginning, but now such pharmacies like Walgreens that you may go to, or perhaps even Walmart, they're even turning down individuals and will not even allow them to be able to get the booster shot, as for, people trying to make sure that they are covered. So that's an awesome explanation. Would you like to comment on that, Dr. Colbert?
And that's a perfect segue. Again, perfectly played. Thank you. Just to give some context, because this is a common question that I'm confident that, again, my colleague as well shares, is that patients will come into the emergency room and ask, well, the FDA states X, Y, and Z, or the CDC says what. Just to give some context for everyone, think of the FDA. So the FDA gives approval, or it authorizes certain medications. So basically the FDA says this medication is a go. And then we patiently wait for the CDC to provide insight or guidance to how this should be distributed. So, and again, what happens is an individual watches the news and says, well, the FDA, apparently I'm supposed to get a booster. And they come in the emergency room and say, well, I'm supposed to get a booster. And you are. However, there's certain policies or certain regulations, and and to add further insight, right now the conversation is for seniors 65 and older, for those in high risk, and those that have underlying medical conditions. Again, seniors, high risk, or those with underlying conditions. Those are the individuals in reference to boosters at this point, which we're looking for the CDC to add guidance or guidelines for those individuals. We're looking down the line for those individuals who are 40 years and older. So right now we're talking specifically seniors, high risk, or those individuals who have underlying medical conditions, that at this point the boosters are recommended. And again, there's further data, there's further information on, again, to expand this conversation would be on pediatric patients, those 5 years and older, or those 40 years. But right now, specifically, those individuals that are high risk, those are those individuals who work in hospital settings, nursing facilities, living in nursing facilities, seniors, and those with underlying conditions, in which the conversation of having the booster. And as my colleague had stated, right now we're looking at Johnson & Johnson, 2 months, and with your Pfizer and your Moderna, 6 months as well. So if you receive your vaccine within that time, the booster can be, at this point, the conversation is that's when you're looking at having the booster. And again, the booster just used to boost your immune system. This is not new to medicine either. Tetanus is something that we receive a booster for. So returning to see your medical provider for enhanced immune response is something we have always done in medicine. I appreciate the conversation that we often have from patients, but a lot of this, it's not new, but it's new to conversation. I understand the apprehension and the caution, and I always recommend to have further conversation and expand the dialogue so that we can all move collectively, specifically those of Black and brown populations who are at the lower socioeconomic area, and we see higher numbers specifically in those populations.
Okay, great. That's fair
enough.
I'd love
to just expand on.
Go ahead.
I was just going to say,
go ahead, Dr.
on what Dr. Colbert said. Yeah, right, spot on in explaining that this is not new science, right? And one of the beautiful things about this period for physicians is that we're actually getting to have these conversations with patients, and they're talking back instead of us explaining and they're like nodding on their head, yes, we get it, and then move on, like the tetanus. But one of the things that comes out in terms of debunking myths is because we still have two segments of the society. One who are like, I don't want COVID, give me anything I need to protect myself from COVID, and then we have the other group that's like, keep that vaccine away from me. From the group who care to be vaccinated, right? The biggest, and it's true, and I see them all the time, the clarity about the boosters is if you just got vaccinated last month, you don't need a booster. You don't need a booster. Don't pretend to get in the line for the booster. And that's important because you have to understand the point of the booster is boost your immune response. But you have to give your body some time to respond. You have to have your immune system has to actually physically be responding to the vaccine the first time. So that is why that 6 months especially for the Pfizer and the Moderna is so important, because we want to give our bodies time to respond and see what it does and get to that threshold. Where J&J is still, and as a physician, I have to be honest and frank with my patients. We got to look at this data right, because yes, the 70% threshold wasn't that high compared to the others. It was pretty high. And so now that it's cleared, as Dr. Colbert says, cleared by the FDA to give a booster, we got to really make sure everyone's on board about the recommendation to go ahead and do it, and in what population. So, of course, in the populations at risk, and I'll expand that risk pool from the high risk for people of color that are in low socioeconomic backgrounds. We tend to forget the prison population. We tend to forget people living in boarding homes, sober living facilities where there's high concentration of people. They are still high-risk groups. And so they are also included in the group that should be considered for vaccinations and boosters. But I just wanted to expand that. But, again, the goal is to really fine-tune in who you are, where's your ecosystem, how are you most affecting the population as much as it's affecting you. And so then what do you do? What is your care plan?
Okay, so do we have Dr. Jeter on the line at this moment?
I am on. Can you hear me?
Perfect. Thank you. Good morning and welcome. The rest of the panel is already here. Great. And so we're gonna go back and we're gonna let you explain to the audience, tell the audience a little bit about you. And sorry for any communications or frequency issues that may have occurred first. And so just go ahead and explain to the panel and to the listeners as what you do and what your practice.
Terrific. Again, thanks so much for having me. Apologies for the technical difficulties. So I am Dr. Geeta Nair. I go by Dr. G, and I am a rheumatologist at the University of Miami. And I've really built my career taking care of those with chronic conditions and immunocompromised states, such as Dr. Nana was talking about earlier. I also have a passion for technology and digital transformation. And as we think about all the things that we've been forced to figure out with supply and demand issues and physician burnout, a big passion of mine is also just scaling that conversation between patients and doctors as we think about particularly the area of misinformation and the era of misinformation that we are living in. I think it's important to think about, how do we attack that? This podcast is a great start, and, what tools can we put in the hands of patients and doctors to also bring that connection closer?
Can I add very quickly? For everyone listening as well? My wife is a rheumatologist, and when we go out, everyone says, "What is a rheumatologist?" Is it possible that you could go into detail what the rheumatologist does? Because specifically with this audience of lupus and rheumatoid arthritis, it would be great for them just to have a really good understanding of that.
You got it. I appreciate the question, Dr. Colbert. So a rheumatologist is basically someone who studies the immune system and is someone who takes care of folks with chronic diseases, but really in an autoimmune capacity. A lot of folks don't understand what autoimmune means. So basically, to break that down, it means that the immune system is essentially turning on itself. So patients with lupus, rheumatoid arthritis, psoriatic arthritis, these are all the types of patients that a rheumatologist might see. And really, it's that the immune system is confused and thinks that your own body is the infection. And so often the way we have to treat these patients is to actually suppress their immune system so they, in fact, don't damage their own body and particularly their joints. I hope that's a little helpful.
Okay. Thank you so much for that.
That includes sarcoidosis, for anybody listening, family members, sarcoidosis, lupus. This is the perfect time to call in and ask questions in reference to someone who's immunocompromised. You have a specialist available to ask a question.
Okay.
I'm done.
Dr. Jeter. Dr. Jeter, this is Dr. Chris, you fired. Dr. Jeter, this question is for you, okay?
Sure.
So we have three different vaccinations, okay? We have three different companies, but you have one company that continues to struggle. So we have the Johnson vaccine, we have the Moderna vaccine, which nobody understands that either. We have the Pfizer vaccine. So with the Pfizer vaccine, of course, that's popular because Pfizer is a company that has been around for a long, long time. Moderna is something that people somewhat kind of trust, maybe 80%, and there's a very, very low percentage that trusts the Johnson vaccination. So we want to talk about that as to why Johnson & Johnson continues to struggle, and then also share with them if this is the same Johnson & Johnson with the baby powder and the other type of chemicals that they, perhaps may create and produce for individuals. But it appears, because I saw it in the news, I think a couple of days ago, they still continue to struggle with making sure that their information is correct. They're struggling with the issue of the vaccine, whether it's credible or not. And so we want you to be able to share that with us, if you could, about the three vaccinations, and then the other colleagues can also comment on it as well.
Sure. So, Diane, I think the first thing to keep in mind is that we are so privileged to have so many options of which vaccine to choose. That is certainly not the reality in many parts of the world still. So I think we want to be very mindful of the fact that we do have choices. And ultimately, the decision of which vaccine is going to be a decision that you make with your physician based on your own individual family and risk. So what do I mean by that? So with J&J in particular, there is concern for this rare clotting disorder in women that are 50 years old and younger. So, if you're 50 years old and younger, perhaps you then want to consider Pfizer or Moderna. With the mRNA vaccines, there is some concern, again, about a rare possibility of having a side effect of endocarditis in young men who are 30 years and younger. So perhaps they want to consider J&J. But the point is that with the new FDA decision is we have choices. We have options to now mix and match. And so it's just really important to weigh all of these things in. But the bottom line is that you want to get vaccinated. All three vaccinations work. All three are effective. And there's really no time like the present to have that conversation with your doc.
Okay. Dr. Nana, would you like to comment on that?
I knew the baby powder thing was going to come up. I don't think I ever get on a platform without talking about the baby powder situation in J&J. So I thought that was kind of funny. But it's true. I think that it comes down to trust. We're in a world, as Dr. G mentioned, that there's a lot of information out there that's fraudulent, and people are gravitating to the places they trust, whether the information is fact or not. And let's put it plainly, in Black and brown communities, especially Black communities, J&J has lost a lot of trust. And it comes from, how many people use baby powder. But the association doesn't include causation and trying to emphasize that just because J&J has this outlying issue has nothing absolutely to with the actual J&J vaccine that's happening now. Okay. Now, that being said, right, I think the other important thing is what Dr. G mentioned is that if these are rare associations that we collect the data through a VAERS database to look at adverse effects, and now begin to study them. And that's why it's so important for people to report their adverse side effects. It doesn't mean that everybody who fits this criteria is going to get it, and so they should not touch this vaccine. Is that there have been rare cases that we've been so sophisticated enough to think and be cautious enough to actually study and provide this data. So actually, that's just a sign that we're doing really great work. And this is still new science. So we're going to keep collecting information, and we should encourage people to be part of this science discovery that we're going through while also making safe decisions for themselves and their families.
Okay. Dr. Covert?
This is a stacked house today with the panelists speaking. I have nothing more to add. Everything that was said perfectly on that topic. Okay, fine. So we just, as I stated before, we just wanted to make sure we, kind of clear up some things that are,
Dr. Fauci has made some statements. Okay, of course, he's from the CDC, and then you see other statistics from the Johns Hopkins report, and then you see a whole lot of other articles that are out there, and the people are somewhat confused. They don't know who's supposed to be taking what, and so that's the purpose of us having this discussion on today, is to make sure we clarify and try to give the best facts that we can be able to give. So
I think it's very important to not mix where you're getting your information. Like, you can't go to the CDC to get information and then go on TMZ to get your information. 9 times out of 10, TMZ is not going to have what you're looking for. Go to CDC guidelines. Go to and I realize that everybody has an aunt or an uncle who used to work with a nurse or was a nurse or lives next door to a nurse. Speak with your physician. Go to, or I used to work at Walgreens in the Band-Aid department, and I know the blah, 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 blah. I've heard it all. God knows I have heard it all. I've heard it all, literally. Mm-hmm. And we're only laughing because it's a shared conversation. But with this, I don't get frustrated, because the biggest thing I've found in all of this is that there's a theme of people losing their humanity. They just get frustrated and say, screw it. And someone says, screw that, screw you. And then you have a whole room of people who aren't listening, and collectively we have a negative effect. We've had an ebb and flow. Last year in 2020, the numbers were looking good, and we said, hey, hopefully Thanksgiving doesn't turn bad. And Thanksgiving turned bad. Then we had the vaccine, and then everyone started getting the vaccine. And then you turn the corner in 2021, and boom, specific states, the numbers just go up. And it's so preventable. It's so preventable. My analogy when I speak with patients it's kind of like you have a friend who wants to walk in the rain. And I get it. If you want to walk in the rain, I guess walk in the rain. You may catch a cold, but you can use an umbrella. And they're like, no, I just want to walk in the rain. And then they walk into your house and track water in your house. Like, hold on. If you want to walk in the rain,
I'm going to use
you can walk in the rain.
That is wonderful.
You can't track water at my job. You can't track water into my home. You can't track water into where my children learn school. Like, that's where we're having a challenge. And then, well, your kids are safe. They're not going to get a cold because I walked in the cold or the rain. You have no idea if that's true. You have no idea. And plus, we're at a place where we have umbrellas. Just pick up this umbrella. It's not going to rain every day. The sun is eventually going to come out. But right now, in the rain, can you please use this umbrella? It's not a big ask. It's funny because, and I'm not going to go on the soapbox, but thank you for listening, because I just returned from deployment. We were in 3 different countries. We were in Central America, we were in South America, and while we were deploying South America, we ended up going to Haiti for the earthquake. And it's so humbling to look at different countries navigate through a pandemic. I went to countries where they don't have money for masks, more or less the vaccine. When I was in Central America, the physicians decided collectively we will forego some of our vaccines because we at least have resources to mask. Let's provide these vaccines to people that are 65 and older. When I was in Colombia, there were some areas that were voting because they didn't have access to vaccines, and they felt the government wasn't even offering them. And so I'm there for 4 months with other soldiers. Then we returned back to the United States, where the truth is merely an inconvenience. It's not a truth as, hey, it's insightful. Truth is a resource. It's just inconvenient. And when you step outside, of the United States and see this, then you come back in. You know, it's kind of like I felt like I came back to the United States and said, hey, who moved the furniture? Who moved the furniture in this house? The TV was someplace else. The living room was someplace else. And it's just very humbling. And again, it's my hope that this conversation is a catalyst for better dialogue and a change of health for those individuals who need to hear this message. And I'll end right there. I'm sorry. That's my time.
You good. So this question is going to be for Dr. Jeter, and it can also be for the rest of the panel as well. So especially for Dr. Chris. but we'll start with Dr. Jeter first, and this is in regards to the spike of the COVID-19 with the children, and also why do you think that parents are reluctant? I mean, I don't. That's something that I don't understand as to why the parents are reluctant to giving their children the vaccine. Here in the South, we have had several children to pass away because the parent did not, get the child vaccinated and what have you. And then also it's a lot of conflict because when we were going to school back in the 70s and what have you, when I was going to school back in the 70s, you couldn't go to school unless you got the chicken pox, vaccination, or you got the measles and the mumps and what have you. So I'm not for sure as to why it's such a big conflict today as to why parents are reluctant to allow their children to be able to get the vaccination, especially in public schools. It's a requirement.
Well, Diana, I'm happy to answer that one, and I'm equally as frustrated as Dr. Chris and Dr. Nana on this one. So, again, what we have is so many folks taking advice and information from all the wrong places. And the example I give to many folks is, I certainly wouldn't go to my mechanic and ask them about my hairstyle advice or go to my mechanic for a haircut, right? It's not going to be a great haircut. I think we can all agree, right? So why would you go to anyone else with your questions about a vaccine or anything related to your health or your child's health besides your doctor? And unfortunately what has happened is people are finding it easier to go on TikTok, Facebook, their neighbor that once upon a time removed the tooth. We're going to all the wrong places, so we're getting all the wrong answers. And all of us, I'm a parent as well, we have fears. We certainly want our children to be happy and healthy. And so what has happened is we have let those fears dominate logic. And while, as Dr. Nana mentioned, there is information, there is research, and we are finding out these small, rare chances of a side effect from the vaccine, but that's why you have a doctor and that's why you're monitored when you're given these things. But outstandingly, the risk of getting COVID-19 to any unvaccinated person, whether it is an adult or a child, far outweighs the risk of any vaccine that is available on the market today. So I strongly encourage anyone that has fears or questions to talk to their doctor, to get a doctor. And that's the other problem, is many folks don't have a primary care doctor or a pediatrician. Don't wait to get COVID. Don't wait to get cancer. Don't wait to get diabetes. You should always have a physician that you can trust and that you have a relationship with to ask exactly this question. But key to getting out of this pandemic is vaccinating our children, and we must make an informed choice and make a move on that.
Okay. Dr. Nana, would you like to comment on that?
I just echo everything she said. I mean, the key is getting people more connected to an ecosystem that they can trust. And that trust system has to be something that's validated. And the validation comes in that profession that knows where to get their information, how to distill facts from fiction. And so the more we can get people directed to the areas where they're going to get the right information, the right facts, I think most people will gravitate and feel more comfortable about getting vaccinated.
Okay. So now this question right here is going to be for Dr. Chris, because Dr. Chris Colbert, he sees a lot of patients first on, and it's a lot that he sees right there from the drawing board. And, of course, we want to be able to learn more. And plus, let me tell you all, too, that Dr. Chris is like a ABC or CBS type of star also that's always answering questions on these TV shows. He does. I'm just letting you know he's all over the news. And that's good, because we want to continue to talk about things where people do not want to talk about it. Here in our location, there are hundreds of thousands of people that still have not gotten vaccinated because of the references and information. So, Dr. Chris, from your perspective, where you're at in the Chicago, Illinois location and things, how has the COVID digressed, and what other tools and resources you all continue to use to be able to encourage individuals to get vaccinated?
Well, the uncomfortable reality is that I'm having this conversation in Chicago, Illinois. So there's policy in place to support certain practices. If you look at different policies in different states, that has significant influence on what happens and patient outcome. So you can walk in the streets in Chicago and people look at you crazy if you don't have a mask on, depends upon where you are. You can walk in different states and be in different places and you have a different outcome. And that has a huge outcome on what comes into the emergency room, resources available, resources for conversation. The numbers in Illinois are looking pretty good, but they've always looked pretty good in conversation of COVID because we have mask mandates, because we have significantly shut stuff down certain times. You can go back and forth on the relevance and not speaking in reference to the economy. I'm specifically speaking to health. It worked. It worked for us. So specifically in healthcare, it worked for us. We have less people that have our numbers for the ICU admissions, our numbers for admits to the hospital were pretty much par for the course for other states that practice these policies. So when there was a huge surge most recently in hospital beds, as an example, in Texas and Florida and Alabama, you didn't see that in certain states. And there was a reason why. And again, you just have to implement and just have conversation. And to go back just 30 seconds, it's extremely important, as was stated earlier, it's just trust. That's why patients listen to the mailman who they see every day, whose neighbor was a nurse or dated a nurse, because they trust that mailman. And even though the mailman gave not the best advice, I, as a physician, need to work to maintain a relationship or that trust so that we can engage in conversation on health. And we had a conversation about pediatrics, and so I may be dating myself and also dating my parents, but when I talk to family members about vaccination for their children, I say this. Do you remember when you were a kid and your older brother or your older sister got the chicken pox and your mama threw you in the room?
Basically.
And your parents, my parents who had no medical education at that time and no college degrees, they knew that if one of our siblings, or even if we had a cousin that had the chicken pox, all the younger kids were in the same room with that older child with the chicken pox so they could get chicken pox and be done with it. This is kind of like that same thought process is you provide a vaccine, you provide a booster so that you can have your response and get done with it. Like as a country, we just need to move forward collectively so that we can transition into the next part of whatever history we're going to, and COVID will be the backstory. And this is the way to do it. And so I recommend, as was communicated by Dr. G and Dr. Nana as well, not only communicate, but get the vaccine. Look for the vaccine for your children because I have a 16-year-old, an 11-year-old, and an 8-year-old. My 16-year-old has his vaccine. He will look at me every day, and just because he's on the basketball team, he will look at me and say, Dad, why do we have to wear masks while we're playing basketball? I was like, I know it sucks. And I don't really like wearing a mask while I'm in the bleachers watching you play the game. But I know we're safe, and we're not always going to have to do this as long as we do this now. Now get in this game and leave your dad alone. But that's what we have to do. Okay.
Absolutely. And I think conversation, as I stated, it was a comical comment earlier, but I'm serious. In the Chicago area, I see a lot where you are bringing it to the news broadcasters and what have you, and they are asking for your expertise. And I think that is very, very important that we continue the conversation so that the entire Americans, and also we need to watch, foreign travel as well. We have to keep an eye on that as well as to the numbers and statistics as to the growing, COVID-19 patients. So we're going to also go to you, Dr. Nana, and ask in your location as to how effective resources and tools are in bringing bringing awareness to more of the COVID, because even now, as I'm going to piggyback on what Dr. COVID had mentioned earlier, I think it was Dr. Jeter, it's locations. Well, it may have been Dr. COVID, it may have said that, but anyways, in certain locations, people may react differently. They're still fighting individuals on, airplanes if you don't have a mask. So we wanted to learn a little bit more about your area, and then also as to what type of resources that you all are bringing to the table, or to the other physicians that are bringing to the table, to make sure that the public is aware and the importance of getting the vaccination.
Yeah. So actually did my residency training at University of Chicago. So Dr. Colbert, many moons ago. The South Side of Chicago is very different than Chicago, Illinois. And if there's a policy for the state, doesn't necessarily mean the South Side of Chicago has a buy-in. And I say that with a caveat that South Side Chicago can reflect just about a lot of urban centers across the country. And the source of their information could be different than the national standard. Who's the who and who can be trusted in a lot of urban communities is different. And so as a medical community, I've learned that you can't shun that away. I mean, you have to find out who the source is, right, and elevate that source to be more educated, because they will disseminate the information, whether right or wrong. And I think that's what happened for us here in Los Angeles. We have Sheriff Harvest is a network of allied health professionals, minority professionals, and we got out here really fast because we knew that if we were being the face of reason in communities of color, we were going to lose this even worse. And so getting people access to physicians that look like them, and building that trusting network that wasn't going to be a one and done, wasn't a campaign, wasn't like a quick, commercial about a vaccine, but really starting to build a network, a relationship for people in the interim. Because let's be honest, we have this campaign in this together, and the number one thing that was the response to that is like, well, you haven't thought about me when I had asthma dealing with in my community and my kids been in and out, right? Why are we talking about COVID? COVID's not affecting me. The police is affecting me. The violence is affecting me. So having those real conversations like, you're right. Yep, you're right, and now I'm listening. And now I'm going to connect you with these other outside resources, because we really got to address that. We got to believe that it's not a one-and-done issue because we're talking about COVID. And I think that's where the conversation's been. We're in a beautiful space as a healthcare system in the country because we're talking about health inequities. We're bringing it out to there. There's systems in place to try to implement new change. So it's not so much about how do we get our message out to the community, and it's about now that we're here trying in a space that we're listening, how do we build a better healthcare system for all, right? And so that's what our focus has been. We have an 800 line. People can call and say, hey, I don't understand this. I just read this, or my neighbor or on the corner just told me this. Is this true? And we take those calls in 24/7 so we can start getting people the right information. But beyond that, we want to get people linked to getting health care, like Dr. G said. So getting them sign up to any kind of health care system, whether they have insurance or not, is always the emphasis, because once you're connected to a system, then the next step is making sure the system that works, right? Because as an ER doctor, I know you can have health care, but getting it to work for you is a whole nother conversation altogether. So we just have to be honest, and we got to accept that we failed, but this is not the time to dig in. It's the time to lean in.
Okay, that's correct. And so this will be the next question. This is for Dr. Jeter, and it can be for all of the rest of the panel too. So this is going to come from the from the inside out instead of the outside in. Everybody has always talked about what's going on the outside for Americans and as also for global foreigners, if I can be able to use that word, foreigner, or those that are traveling from foreign countries over here to the U.S. and vice versa. So now we're going to go on the inside of the infrastructure, okay? And so here's the question, Dr. Jeter. There are doctors and there are nurses. There are practitioners behind prison bars. Prison bars. These people cannot choose a doctor. They cannot choose their own health care. They have to rely on the nurses, the practitioners. Okay, and so they had, I think the Bureau of Prisons. They had the head director on the hot seat. On the House of Republicans and what have you, because of how he mishandled the COVID issue with the prisoners, and so many died behind bars. So we want to be able to cater to them too. We want to be able to cater to physicians that and nurses and doctors and nurse practitioners that are behind the prison bars with the prisoners. They are just about to pull their hair out as well because they don't know how to handle the situation. I have seen live pictures as to how they have handled some of it. They just have a big old large gym, and the ones that are infected, they let them lay on top of each other. We've actually seen actual pictures of this going on behind prison bars in different states all over the United States. That's the reason why they had him on Capitol Hill, and they was grilling him, in which they should have. He should have been grilled. But the doctors behind bars, they're limited. So we want to talk about that, about the doctors that have to go into the prisons and things like that. What type of resources do they have to be able to combat this, in your perspective?
Sure. So, again, as a medical expert, not as a political expert, this entire crisis has been just tragic. And tragic not just because of access and resources, but because this is so preventable. I mean, we have so many options. We just talked about all the different vaccines and combinations, and that you can go virtually anywhere. The access issue is going to get better with regards to the boosters and it being available not just in retail pharmacies, but also in different doctors' offices and urgent cares and such. So this is just showing more and more how fractured our healthcare ecosystem is. And everything is not equitable and everything is not fair, and we have to think about our healthcare infrastructure. A big part of why we are in this mess is that we do not have enough doctors and nurses. We do not have enough tools and technologies for them, and we do not have good health literacy. The fact that people can be so confused by a TikTok video or by their neighbor, as Dr. Chris said, right, or their neighbor that they trust more than their doctor, it is a problem, and it is something that will have to be what we reflect on for the future, so that this is never repeated. But all of this is heartbreaking across the board.
Okay, Dr. Chris, you want to comment on that as the physicians behind prison bars? I know everybody can wash their hands, but if I've worked in a institution for the federal institution some years ago, and that water does not come out fast, just like our, water system does. And so what can be done for the physicians that work with prisoners behind bars, in your perspective?
So honestly, that is a whole lot to unpackage. We could have a show on that in and of itself, because those patients come to the emergency room. Those patients come to the emergency room. A lot of those patients come to the emergency room. This is multifaceted. We're talking not only medicine access or medication access, but access of space. So medication access, access of space, the comorbidities. Every patient isn't the same, and so when you're in an incarcerated system in some capacity, you don't have those options. And so the question is, because honestly, what you're doing is you're kind of backtracking. You're saying, so now that we have this concern that requires space and isolation, how do we create space and isolation in a controlled setting in the first place? And also, we have a place that has a specific number for money. I mean, specific money for medicine. If we cap at $10, and the medicine itself may be X, Y, or Z money, and what do you do when you reach that cap? How do you balance that out? Because, again, patients also have asthma. They also have diabetes. How do you distribute that wealth? That's not an easy answer for anyone. The best we can honestly do is make a list of the challenges and from there address them and have realistic expectations of how you will address this. Because how you will fix this at a hospital is different than a jail setting, is different than a juvenile detention center. There's so many aspects that it needs to be addressed. And there was a comment earlier in reference to the fractured healthcare system. So, again, I've been to different countries. Everyone has a challenge of navigating healthcare for their citizens. Everybody does.
Okay.
And I say that as a point of we're healthcare, but what we actually practice is sick care. Healthcare means we're working before the problem gets bad. But what we end up doing is sick care. Like we're treating you because you have the cancer that is attributed to smoking. If we just had a really good policy on decreasing smoking, that significantly decreased lung cancer. If we have people increase in wearing masks and getting the vaccine, that's going to significantly decrease the admissions to the ICU, and that, by definition, is health care. When you come to see me, you're already sick. You're already sick. That's a wrap. We are on a different point of conversation. So if we could focus on health care, which a part of health is preventative. It's eating well. It's receiving the vaccinations. It's following through pediatric vaccinations with your children, with your patients, with your pediatrician, and having good dialogue, seeing your OB doctor on a regular basis. Because the bottom line is we are the doctors by default. Dr. Nana and I are doctors by default. No one wakes up and wants to see an ER doctor. People will spend 3 months to prepare to see their rheumatologist because the rheumatologist addresses chronic concerns and makes them feel better forever. I see people when they're walking their dog trip and break their leg. No one's happy when they see me.
Okay.
Their day was planned to do.
Speak for yourself, Dr. Colbert, right? my patients are bubbling.
my patients are bubbling when they leave. They're like, they had. I'm walking to my car for my child's birthday gift in my hand. And I drop the cake and I break the ankle, so I can't go to the birthday party. Everyone's at the Showbiz Pizza. And Mama's here in the emergency room, and the first thing I do is, "Hey, I'm Dr. Colbert. How are you doing?" "Horrible. Since you're here, let me tell you about it and fix my leg while you at it." But the reason I say that is because this is still about health care and sick care. I think if we focus more on health, which is a lot of preventative medicine, which is right down the rheumatologist, Dr. G's alley, and we're on the opposite side of the street, both Dr. Dan and I, but it's a community of physicians that are working well for our community to move forward better and with insight so that people make informed decisions. And that's what's important, to have this discussion, to expand the dialogue so people can say, you know what, I heard Diane, I heard the 3 doctors, and this may change what I do. And that's what I hope from this conversation people walk away from it.
Absolutely, absolutely. So, Dr. Nana, hold on for a second. We're going to pause for a second because she said that speak for yourself. Hold on. Okay. So, Dr. Nana, we want you to be able to share. So, some of the experts have said, COVID is here to stay. Okay. We've had several physicians that have been on the show as well. Earlier on, Dr. Chris been on here. This is probably his 10th or 11th time. But there are other physicians that have been on the show, and they have predicted that COVID is here to stay. Even though it's simple hand washing, put your hand over your mouth when you're coughing, what have you. So, what is your perspective on that? Because we want to be able to keep the audience up to date. We want people to be able to. That's the reason why I keep having these conversations, so people can either digress or they can be able to feel comfortable in getting the vaccination and also protecting themselves. So what is your perspective on that quote that COVID-19 is here to stay?
Yeah, I agree 100%. Remember, at the very fundamental cellular level, COVID is a virus just like any other virus. It's the flu. It's the adenovirus. There is question about its origin story, but it is in our ecosystem. It's all over the world, and its job now is to stay alive. And our job is to keep it from stopping our lives, right? It's not our job to delete it from existence. It is part of our ecosystem, period. But can we manage it enough so that it doesn't shut down schools and jobs, that it doesn't kill people, it doesn't make immune-compromised individuals even more immune-compromised? And this is where it gets to the bigger messaging that we have. This has been like a curse and a blessing. It's a curse because we were totally blindsided by it. We weren't prepared. All the inequities, all the potholes in our health system that we already knew about, we ignored, and it came to bear with this, right? So that was the curse. Okay. But the blessing is that here's our opportunity. We're, I like to say, down on the downslope, right? And we're now able to use this opportunity to learn and fix the problem. And speaking back to the question you had, I think, more than a fixed care system, this is a real issue of human rights. We say it, healthcare is a human right, but our policies don't suggest it. We do not, as a company, subscribe to healthcare being a human right. And as a result of that, you are going to have inequity. There's just no way to provide fair, equal, accessible care without policies to match it. And when you're talking about, and I work very closely with prison systems, one of our largest partners is Homeboy Industries, the anti-recidivism program in LA, and all we deal with is people who have come in and out of the system and now are seeking health and social care. The patients is one issue because they don't have rights. They don't have rights. And as a society, we like to think because you've made a mistake, you should not have as good as health care as everyone else, right? And then there's the issue of capacity and the pipeline. We don't take good care of our providers mentally, financially. I mean, how do you ask somebody with six-figure student loan debt to be the best doctor they can be for a prison person? Like, I mean, it's the reality of it is insane. And that's what we're seeing with more providers retiring early, younger providers choosing a whole different route and not even going to healthcare systems, dealing with the electronic medical system that doesn't really cooperate. So these are the confluence of a system gone awry, and we're still in the midst of pandemic. And it's not surprising that we're having so much problems getting over the hump because we get 2 steps forward and take a step back, 2 steps forward, take a step back, because there are underlying system issues that have been failing, and we can't use Band-Aids anymore. So I think that for me, yes, the elephant in the room is bad healthcare systems and poor relationships and building for providers all across the board, all I had professors. So we got to get to people loving to do medicine again. But the distractor is COVID. COVID's going to be here. Move it away. Wash your hands. Social distance. Get your vaccine. And let's take care of the bigger problem.
Okay. So this is going to be the last question for the segment of the show today, and this question is for Dr. Jeter. And so, Dr. Jeter, some of us are aware of the death of Colin Powell. This is not a political question. It's just we want to be able to share with the audience the pros and cons on both sides. We don't want anyone to be leaving where they didn't talk about this. I didn't get the answers about that. So we're going to talk about this additional option because it was stated, of course, in all the articles and the news reports that he was fully vaccinated. So in regards to that, how can Americans still be able to feel safe even if they have received both of the vaccinations and they still be able to get the COVID-19? Because I would think that some of that may come with underlying conditions as well as to why some, and the statistics are very, very low for individuals having COVID-19, and they still have already gotten both of the vaccination shots. So we want to talk about that. This will be our last question of the day, but still we want to touch on that as well, as to how individuals can be encouraged to continue to be able to get the shot even if they get COVID or know someone that has gotten COVID after they have been vaccinated.
Sure, Diana, great question. So I'm going to answer that. We're talking about the general population, and then I'll come back to General Powell. So as we think about the general population and the purpose of the COVID-19, the purpose of the vaccine is to prevent you from getting incredibly sick from the virus, i.e. a hospitalization, an ICU visit, or a death. Now, you can still get COVID-19, just like the flu shot. You can still carry the flu even if you've been vaccinated, but the detrimental effects of the virus is very, very less likely in someone who's been fully vaccinated. And again, I use the word generally, right? So every human body is different. And remember, General Powell had multiple myeloma with treatments for this. Again, whatever has been shared about his medical health and status, he was not a young, able-bodied, healthy individual, right? He was later in his years. Okay. He had a pre-existing condition, which was quite serious, and treatment that was quite serious. So what we have to remember is that everyone is at a different starting place, and susceptibility to any infection and the detrimental effects of that are different. And he did the best thing by getting fully vaccinated. He has lived a long, healthy life, and perhaps, earlier on in the pandemic, he may not have been safe if he was not vaccinated. So we have to understand that every body is different. And folks with asthma, COPD, again, folks who are immunocompromised, like the patients that I see, even more important to be fully vaccinated, because the starting place of where that individual is versus someone who is young and healthy is going to be different. So the name of the game, like Dr. Chris said, Dr. Nana has been saying, it's putting on the raincoat. Does that mean that you can still get wet? Of course, but you're less likely to get drenched. And that's the bottom line with the vaccine.
Okay, perfect. So now this is where our guests can interact with our audience and the listeners. So we're going to start with Dr. Colbert, and you can be able to tell the listeners, share with the listeners as to how they can be able to connect with you, any websites that you would like to be able to share, and any new release publications that you would like to provide for the audience. You can be able to do that now.
First and foremost, I appreciate being on this panel with these amazing physicians. Thank you, Dr. G, Dr. Nana, for your insight. This is just a really great way to end. As Diana's, thank you for the invitation. My name is Christopher Colbert. I communicated on the APD at University of Illinois. My Instagram account is drchris.er. That's drchris.er. And Twitter is drchriser. November the 4th, we are having a social health justice symposium, which you can tune in virtually, and we are awarding those individuals and acknowledging individuals who abide by the sciences to help mitigate the effects of COVID across the nation. You can get further insight from my Instagram. This was great. Everyone stay safe. And again, I thank all the panelists for their insight. This was extremely impactful and beneficial.
Okay. Dr. Nana?
Yes, I echo that. Thank you so much for inviting me, and this was a very stimulating conversation. If you want to be part of the Shared Harvest Initiative, you're an allied health professional, you can sign up at mycovidmd.org, covidmd.org. We have two big campaigns right now. One is $20 million by 2022. We are raising $20 million for allied health frontline emergency workers to reduce and eliminate their student loan debt. And we also are working on pipeline programs to get more professionals to be culturally competent and engage in communities of color in a more effective way. The other thing we're continuing to do is our pop-up community-based COVID testing and vaccination sites. We have a Dia de los Muertos event happening this Saturday, the 23rd, at El Pueblo Square in downtown Los Angeles, and we have another event happening on the 30th. So I encourage you all to follow us. The best way on Instagram is at Shared Harvest with a T, Fund, F-U-N-D, on Instagram. And my LinkedIn is the most popular thing that I do. So you can find me, Dr. Nana, on LinkedIn. So thank you again for inviting me, and thank you for the honesty, and I hope all of you guys have gotten a little bit of something from this talk today.
Okay, perfect. Thank you. You're welcome. Okay, Dr. Gita.
Diana, again, first, thank you to you, your program, Dr. Nana, Dr. Chris. Such a privilege to be part of the program. I can be easily found via my website, drgeethanayer.com, and I am on Instagram, Twitter, LinkedIn. But the best thing your viewers can do to help me and to help my colleagues is to get vaccinated, get a booster if you're eligible. Happy to have you follow me, but the best thing to do is to have your own physician, making sure you're getting advice from them, and of course, just being mindful of how we can help each other and our communities through this pandemic. So thank you so much.
Okay, great. And we would like to thank all of our guests for being on the show, and thank everyone. And everyone have a great day.
Thank you very much. Have a great day, everyone. Stay safe.
Thank you so much.